Hi, everybody. I'm Zyna.
And I'm Pavi.
And we're with the Urban League of Metropolitan Seattle.
Welcome to Community Conversations, Big Questions Edition.
Community Conversations is a platform for community voices to be heard.
In this edition of Community Conversations, Big Questions, some young people have some questions for providers about COVID-19.
They asked some really great questions, and we got to share them with Dr. Stephaun Wallace and Dr. Estell Williams.
So without further ado,
let's get into the conversation.
Hi, I'm Dr. Stephaun Wallace. I'm a staff scientist here at Fred Hutch, and I direct external relations for the COVID-19 Prevention Network. My PhD is in epidemiology, which basically means that I study diseases and the way that they spread through communities around the world. I understand that there are lots of questions around COVID-19, and I've had the opportunity to work with and hear some amazing questions from some very bright and brilliant young people who've shared them with me, and I'm hoping to be able to answer some of those today.
Hi, my name is Jordan, and I have questions about COVID. How is COVID so strong that it got the whole world infected?
COVID-19 spreads very easily because it is a disease that impacts our breathing system. So we call it our respiratory system. So because of that, and because people travel everywhere and people move around for work, for pleasure, for fun, it makes it easier to get across state lines, across country lines, and to spread globally.
Is COVID just like the cold, but a little bit worse?
COVID is similar to the common cold. It is definitely worse because people can get much sicker from COVID, and because it impacts our bodies and our systems and our health much differently and much worse than the cold.
How much did a vaccine work?
So vaccines work in a few different ways, but these vaccines work extremely well to prevent people from getting seriously sick and ending up in the hospital and on a ventilator, which is a device that helps them breathe.
Hello, my name is Gabriel Blow. I'm 9 years old, and I'm gonna turn 10 in August. Was this the first COVID we ever had? Because the shots seem like they're made too fast and that they're already made. So was there a COVID before this?
This is not the first time that we have battled COVID. This is the second time, actually. And this particular type of COVID, we really utilize what we learned before when we fought it before in order to really help us to understand how to better fight it this time. And because of all of that education, all of that knowledge that we had before, from fighting it before, and because of what we were able to do this time with the science, we were able to get vaccines out very quickly.
Why do we have to take booster shots for COVID? Because we didn't have to take any other booster shots for chicken pox and measles.
That's a really good question. Every virus and every vaccine that's created to respond to that virus is different. And so sometimes our bodies don't create enough of a response or support to our immune system to fight off the virus. So a booster might be needed. Also, sometimes the virus may change a little bit. And so then it makes it really important to ensure that our bodies have the maximum protection. And so booster shots would be needed then as well.
Does the COVID vaccine actually make you immune to the virus?
The vaccines are not necessarily created to make us immune to the virus. They are created and they have been proven to work really well to prevent us from getting seriously sick and ending up in the hospital and dying.
My name is Josiah Clark. I'm 11 years old, and I'm in 5th grade in White Center Heights Elementary.
Is this the end of the pandemic?
Unfortunately, this is not yet the end of the pandemic. We still need to ensure that we get vaccines to people that need them most, including people here in the United States, as well as people around the world.
What are all the variants, and will there be more?
That is a really good question. So there are two different groupings of variants that we're looking at. So one grouping of variants are just all of the variants that we happen to find. And then the second sort of grouping within that are what we call variants of concern. And these are variants that we pay extra special attention to because we believe that they might either cause people to become even more sick, that they may be more easily transmitted to other people, or that they may challenge or make it harder for the vaccines to work as well. And these are variants that we're constantly monitoring, and it's certainly possible that we'll see more variants in the future. So this is something that we need to continue to look at.
Hi, I'm Divine. I'm 10. Should we be concerned about what's in a vaccine and that if it might hurt us?
That is also a really good question. I think it's really important to be aware of anything that you're putting in your body, whether it's a vaccine, a food, a drink, or whatever, and being cautious about what are the ingredients that are in them. The vaccines have been proven to be safe and effective for most people, and there have only been very small cases of people having illnesses or other health complications from the vaccines. But millions of people have received these vaccines that have been proven to be safe.
I'm young and healthy. Why should I get the vaccine?
That's a really good question. It's really important for everyone who can get a vaccine in order to prevent us from getting seriously sick and ending up in the hospital as a result of acquiring the virus. And whether you are healthy and you have a really strong immune system or you don't, you could still be impacted by the virus, and you could still become ill from it.
What is your thoughts about wearing a mask even though the mask mandate has been lifted?
I believe that people have the opportunity to make personal decisions about whether they can wear a mask for themselves and for their families or not. Certainly, though the mask mandates have been lifted, it does not mean that you do not have to wear a mask anymore. You can still choose to wear a mask. And people who may test positive for the virus should still mask, should still isolate. And so there are other reasons why people may continue to mask. They may have a weaker immune system. So there's lots of reasons why people may still mask, and all of those reasons are still very important.
Sometimes the pandemic is getting better and sometimes it's getting worse. Why is that? What's really going on?
This is the first time that many people in their lives have experienced a pandemic. And this is an actively moving virus through our communities, through our country, throughout the world. And so as we continue to monitor, we may find that more people or may get the virus in specific locations, or the virus may change and may mutate and create variants. And so keeping up with this process, keeping up with the science behind this, it's going to be a constant changing, sort of evolving process. And so it's really important that we're all paying attention, that we're all doing our due diligence and ensuring that we are protected and our families are as well.
Hello, my name is Dr. Estell Williams. I'm an acute care general surgeon at the University of Washington, here in Seattle, Washington, and so excited to be here. I am involved in a number of things that involve the youth. I am executive director of the Center for Workforce Inclusion and Healthcare System Equity out of the School of Medicine. What does that mean? It's a very long acronym, but it goes by WISE. And really what we're engaged in is involving youth from kindergarten all the way through right before they enter into a professional school or training program, to really increase the awareness, the exposure, and make for sure that we're addressing the lack of diversity within our healthcare system, and recognizing that health careers, there's so many that you can be involved in to frame and shape and change the health of communities, especially communities that represent marginalized identities and backgrounds. And that is the purpose of WISE, is to make for sure that we follow our youth throughout their entire educational arch, from kindergarten until they matriculate into that program of their choice, and make for sure that we are giving them the exposure, opportunity, and resources to be successful and to gain entry into these different health careers. Outside of that, I am co-founder and run Estelita's Library with my husband, Edwin Lindo. This is a labor of love, literally, because I labored my daughter, Estella, and then we named the library after her. And it is in community, rooted in community, social justice focused library that does community programming, especially around youth. And if you are interested, we will be partnering to bring a group of youth to Watson's Go to Birmingham with Seattle Children's Theater in May. So look out for more information about that. But I'm excited that we're going to be answering some questions from some amazing youth out there all around COVID, being in community with you all, providing quality education from those of us who are on the front lines. And I'm so excited to be answering those questions today. So let's get started.
Hi, my name is Anna Maria, and I'm 6 years old. Does COVID make the baby sick during pregnancy?
Oh my gosh, she is precious. So, Anna Marie, thank you for that wonderful question. And I'm so excited that you're concerned about the little babies. And so are we as healthcare providers. That's been a really big thing. So we really looked at, and there's been a lot of studies looking at the impact of COVID on pregnant mommies and the babies. And really that's when they started looking at getting a vaccine to pregnant mommies to make sure that it can protect the baby. And to also see what kind of antibodies are in the mommy's milk that she feeds the baby to make for sure that it's providing some protection for babies after they're born. What we have found though, unfortunately, is that COVID does have an impact on both the mommies and it can cross the placenta to the babies. Although it's very rare, really mommies and babies are connected, right? Babies are growing inside of mommies and they're so connected that if mommy gets sick, it makes it very hard for baby to thrive and do well. And basically the baby can feel what mommy's feeling and get sick as well. And so unfortunately we have had mommies when they get sick, it means that the baby is sick as well. And that's why we work so hard to protect mommies so that we can also protect the babies. So that's why we're very concerned about COVID and trying to make sure that you protect mommies as they're pregnant, because we know that that can have a negative impact, meaning that it can hurt both mommy and baby if mommy does get COVID while she's pregnant. Let's move on to the next question.
How is the virus getting in our body, in our mouth, in our ears, in our nose, and our eyes?
Well, this is a really good lesson on microbiology. So really, when you think about viruses, think of it as like an ant, okay? We're gonna call it a little insect. And it can travel anywhere. Do you ever wonder, how does an ant get in your house? You're like, I don't see how it gets in. It just showed up. Well, it lives everywhere. We have viruses around us all the time. And some of them, we don't even notice they're there. But then other ones show up, and then all of a sudden, they're on the counter trying to go towards our cookie that we wanted to eat later. And we can't eat our cookie later, right? Why? So really what happens is that, like other viruses that are around us, some of them can find ways to then enter our bodies, because then we act as a host. It's a whole different language when you're talking about viruses and bacteria and science. And that's really fun. It's like speaking code language when you go into science. So if you want to learn a code language, go into science and medicine, because you'll learn a whole different code language and you get to speak about it. Nobody understands what you're talking about. But really, once that virus finds somewhere that it likes to live in, it will find a way in order to enter into our body. So sometimes that's through different mucous membranes. That's the easiest way to get into the cells and get into the body. So if somebody talks and then they have things like, anytime we talk or sneeze, there are certain things in our mouth like saliva that are microscopic that we don't even see, that go out and land on different surfaces. And if you're close to somebody else, it can go into their face and hands. Well, now that provides a portal of entry for the viruses to then get inside somebody's body. There are different kinds of viruses that enter basically through blood transfusions, through needles. That's why we get a poke. There are all different ways in which things are trying to find ways to get into our bodies. And so just like all those other viruses and infections, or like when you get a cold and it finds a way to get into your body, once it finds a way to get inside, then it's going to have different effects on your body. That's a whole different question. But the long and short of it all is that just like an ant finds a way to get in your house when it's really excited to go look for food, that's essentially what a virus is. And we're kind of like the food for a virus or bacteria, and it hunts and finds different ways to get inside of us so that it can live.
I'm Dixie and I'm 7 years old. What is the COVID vaccine made of?
That is a great question. What are vaccines made of is where we can start with, but then we'll dive a little bit more into what the COVID vaccine is made of. So vaccines are things that we're so used to now. We get vaccines when we're babies, some of us, and we get some even when we turn teenagers, and even as we become adults going into college, or even in our older age. Vaccines, the purpose of them is to protect us from different things that can hurt our bodies, different infections and illnesses. A lot of things that our grandparents saw, not even our parents, we have to go back to our grandparents. It's been because vaccines have been around so long. A lot of the things that used to make kids really sick, adults really sick, and really some kids didn't even live to be adults because they got so sick from some of these infections. And then came about a scientist, somebody who asked the question, how do we stop this from happening? Maybe there's something we can give our bodies to build up our immune system and make it so that when it tries to attack us, we fight it off and we don't get sick anymore. Isn't that the beauty of STEM and science? Don't you want to be a doctor or a scientist now? You get to solve things like mysteries. And so basically, that's what a vaccine does, is it helps your body recognize something foreign before it has a chance to make you really sick, and it's able to fight it off so you don't get as sick anymore. And that's essentially what the COVID vaccine does. It takes the same blueprint that's been out there for all the different vaccines that have been around for generations, and it applies it to this new bug, this new thing that wants to infect and make us sick, in order to make it so that our body recognizes it as soon as it tries to attack us, and our body's able to try and fend it off. It's like thinking about having a Spider-Man inside your body fighting off infection before it could ever make you sick. So that's all a COVID vaccine is. It's a mini Spider-Man living inside you. And the specifics of the COVID vaccine and why everybody got nervous is that they said, we made it so fast. But the reality is that we've been making vaccines for so long, we already know how to make them. And so when this new bug came out, it was really just taking the information we already knew and applying it to this new bug to find a way to make our body recognize it and fight it off so it doesn't make you as sick. It doesn't prevent you from getting COVID at all. It just makes it so that you don't get as sick. And that's the most important thing, because we don't want people going to the hospital or needing a breathing tube because they got sick. And if the vaccine can help it, that's a win.
Why do people have to wear a mask?
Ooh, that is a question of the hour. Why do people have to wear masks? I'm going to ask you a question, Drio. Have you ever sneezed on somebody like your mommy? I know you have, because my daughter sneezed on me. And what happens? You laugh after you sneeze, don't you? You laugh because what happens? The saying goes, you say it, you spray it. So when you sneeze, you laugh, you talk. There's certain microscopic saliva and different, right? Saliva. All the different things from our mouth and that actually sprays out into the environment around us. And that can have bacteria in it and things like what? COVID, the virus. And so when you wear a mask, it helps prevent that when you're talking, or if you sneeze, or if you cough, you don't spray out those particles out onto surfaces around you or to other people that can make them sick. One thing you might have noticed while you were wearing your mask during the time that we had the pandemic is that you might not have gotten as many colds. Why is that? It's because you were wearing a mask. Wearing a mask and hand washing frequently prevented the spread of different bacteria and viruses, because again, once you cover your mouth and you're not sneezing on people, coughing, talking towards them, you don't have those particles that go out and can infect other people. So that's why we wear masks, is to keep each other safe.
Will the shot keep me from getting COVID?
Oh, Driel. See, we're on the same wavelength. And I said this earlier when we were talking about vaccines. So the purpose of the vaccine is actually to prevent you from getting as sick. There are other vaccines that actually prevent you from getting the infection altogether. Things like the chickenpox, measles, mumps. Those are things that, especially in infancy and being a young child, can make you really sick and have long-term consequences. Like if you get rubella or measles and mumps, sometimes it can affect things like the way we hear or other things that have a long-term impact on the way in which we're able to live our lives and be productive and fully functional. With COVID, it's having long-lasting effects and side effects that we're just now learning about. And so while we wanted to prevent people from getting a COVID altogether, we haven't quite found a way to do that besides mask wearing, keeping our distance from other individuals, washing our hands frequently. But the good thing about the vaccine is that if you get it, it doesn't prevent you from getting COVID itself, but it does prevent you from getting sick and very, very sick. So sick that you have to go to the hospital and in some cases even get a breathing tube in. And once that happens, that means that it's harder to recover, and that's how some people have died from COVID when they get really, really ill. So the good thing about the vaccine is that while it may not prevent you from getting COVID, it prevents you from getting as sick from COVID.
Is the virus getting weaker or stronger?
The question that you're asking is one that we're really trying to figure out. And what we know about viruses in general is that they can change. They replicate and they change their DNA, their RNA just a little bit because they're like mystery men. They're detectives, they're spies. They're working undercover like the CIA and the FBI. They're always trying to find a way to elude our defense system and come up with a way to make us sick because that's how they survive, is they need to live in a host. What we've seen is that there have been different variations of the coronavirus that have come out. We had our early version of the coronavirus, and then it's changed itself just a little bit to find a way to stick around a little bit longer and keep infecting more people. We've seen that the way in which or how quickly it can spread to people have become easier, meaning it's more likely or more contagious, more likely to spread in between different people. But how sick people have gotten has actually gone down, and we haven't seen as many people requiring hospitalization. Now, is that because the virus is getting weaker, or is it because we developed a vaccine that makes it so that our body can defend itself a whole lot better? And that's most likely what it is that we've gotten a vaccine that makes us stronger to be able to fight off the virus. We don't know if there's another variant out there that can become stronger and overcome our immune defense system. But we know based on history and how a lot of viruses and bacteria work is that they continue to mutate or change so that they can stay alive for a long time. And so they do try and become stronger or more virulent in order to sustain itself so it doesn't die off. It's a living, breathing organism just like us, and it wants to survive just like we do. So it's going to find a way to try and do that. So while we don't know with absolute certainty if it's going to get stronger or weaker, we do know that based on biology, what we understand about how RNA replicates and how other viruses behave, is that it's probably going to find a way to try and become stronger so that it can live longer. But what we're doing as scientists, and what the beauty of science and medicine does, is that it tries to predict these things. It looks out and finds ways in which it might be able to mutate. And the idea is that it can stay ahead of the game and help prevent disease and prevent people from getting super sick, even if the virus is changing a little bit. So even if it gets a little bit stronger, Malik, hopefully there are bright minds like yourself out there who are going to find ways to help protect us from the sickness.
Why is COVID here?
Well, the answer to that is similar to why are human beings here? We're all organisms that live on this planet and have to share it and find ways to cohabitate. Viruses are just important to this planet as human beings are, believe it or not. Bacteria, viruses, animals, dogs, cats, birds, worms, all of us play a big, huge part in the ecosystem, meaning that one is dependent on the other. And believe it or not, we can't survive without the other. It all allows us to basically function in this ecosystem, this interplay between how we all are able to grow and be a part of an entire life cycle, meaning that there are some parts of the life cycle that people are going to play a bigger role in. And for the part of the coronavirus, well, it's ubiquitous. It's been around all the time. What it hasn't done is actually infected human beings. And that's the real question behind why is COVID here. What we do know is that there are are instances where human beings are in contact with certain animals in close quarters, and things that normally live in the ecosystem just in the animal kingdom can transfer into human beings as a result of being in close proximity or in close lived contact with humans. So while it may be things that we haven't experienced before, after we've been in close contact with maybe an animal that has that virus or bug as a part of its life cycle, it then finds a way to jump over, and now it can infect humans as well. And that's what we've seen with coronavirus. I think you're a little bit too young for this, Malik, but back in my day, when I was first starting medical school, there was another type of virus that jumped over to human beings from birds, and it was called the avian flu, also known as H1N1. And while it didn't cause a large-scale global infection like COVID did, it did cause a rapid spread of a type of flu that we hadn't seen before. And so this does happen from time to time, that we see these things jump over and infect new species that they hadn't before. And really, that's just a part of the ecosystem and the life cycle from all of us that have to cohabitate and live on this planet together. We all have our part. And unfortunately, sometimes when it's introduced to new species or new human beings or new animals, it can make them sick until their body learns how to deal with it.